in red, not because I ever point to the ribosome. Why do you need to know ribosome? Because some of this endoplasmic reticulum have ribosomes on them. All right, and that will determine for you whether it is the rough or the smooth. If you see ribosomes on that blue thing that I point to, then you're going to put down that that is the rough endoplasmic reticulum. But if I point to the one, like this one here or this one here, they don't have ribosomes on them, then you're going to put down that is the smooth endoplasmic reticulum. The Golgi is the pink thing. It doesn't matter what the shape of it is. And just look, if it's the pink thing, you put down Golgi. The yellow thing down there, that is the lysosome. We got some of these cut open, but I tend not to use the one that's cut. I tend to use the one that's whole. Now the mitochondria, I could use any one of them, either the one that's cut in half or the one that's whole. Is the orange thing. And the centriole, that's this thing here that has the thing that looks like straws inside of it. A good way to study this is you take this picture, you take one of those index cards, you write down your list here, and then see if you can point them out. All right? And if you can't, you've got to study some more and get them all right. That's the way to do this. So for each thing, for each bone, you should have an index card with the list of everything that you need to know about the bone, the name of it, and all the markings on it. For each model, you should have the index card with the list, if you want to. I'm not going to force you to do that, but this is a good technique. It works, all right? If you're like I was, and I didn't do it. But I learned you got to do that if you want to do well. I could have done better, okay? The next model that we do is the skin model. What's the list for this one? So that's what I'm going to give you now. What's the list for this one? Dermal papilla. So that's the first thing. Make sure you know the dermal papilla. I'm going to point to them in a minute. The next thing that's on the list is the glands. You've got a sebaceous gland, you've got an eccrine or merocrine gland, and you've got an apocrine gland. So there's 3 for that. And the next thing that's on this is the corpuscles, the Pacinian or Meissner corpuscle. So that's your list. You got 2 corpuscles, you got 3 glands, and you got the dermal papilla. So where are they? All of these undulations, all of these little hills here, those are the dermal papilla. Here's a little hint for you. I always point to it out there because there's no confusion. That's the only thing out there. They took the epidermis off and you can see the dermal papilla out there. If I want dermal papilla, I don't ask it all the time. That's got a 50-50 shot. If I put a sticker on that. Where's the corpuscles? Let's do those first because I'm right in there. In the dermal papilla here, we only have 2 of the Meissners. There they are. They didn't bother to put any more. They could have put more, they just didn't. But those are the 2 Meissners. Where's the Pacinian? Those are the ones down. 1, 2, 3, 4. They put 5 of those on here. So if I point to one of these bottom ones, that's the Pacinian. If I point to one of these upper ones, those are the Meissners. Where's the glands now? The eccrine or merocrine. You need to know by both names because you don't know which is going to be the choice on the test. It could be eccrine or it could be merocrine. It won't be that pseudoiferous thing, so don't worry about that. Where is it? Here's one here. It's the one that has the duct that goes all the way to the surface of the skin. There's one, there's another one, and here's another one that's cut open. Those are all the eccrine or merocrine. Whereas the sebaceous one, that goes to this hair shaft, it's all the way on this end here, and that's this one here that's cut open, and this one here that's not cut. Those 2 are sebaceous glands. And the apocrine one, that's this one here. Why are these different? They go to here, because look down on the board here. This is the one that's in the axilla region. Axilla and genital region glands are the apocrine. The axilla and genital region glands that go to the hair shaft, those are the apocrine. Everywhere else in the body, like this says scalp, it didn't have to say scalp, it could have said everywhere else in the body. Those that go to the hair shaft then are the sebaceous glands. All right, so make sure you make that differentiation between apocrine and sebaceous. So there's your list for the integumentary system, for the skin. All right. The next thing we do is the bone model. I don't have to do this twice because I got it all on the same slide. There's our list. You got the central canal, also known as subversion canal. Make sure you know it by both names. You got the layers called the lamella. Those are the rings. You got the Volkmanns. Those are the ones that run horizontal. The ones that run vertical, up and down, those are the version or central. The ones that run sideways, horizontally, Those are the Volkmanns, or perforating. The osteon is the complete circles that you see there with all of the lamella, with all of the layers in it. And the periosteum is this outermost layer here, the blue stuff out here. That's the periosteum, and those tiny little squiggly blue lines, that's what's holding the periosteum on. That's the Sharpey's fibers. So that's your list. You can see how we bracket off the osteon. It might not be the one that looks like a tower. It might be one of these circles here. But we'll use like a piece of tape and bracket it off, and you'll know we are referencing the entire circle. That's the osteon. Each individual layer, that's a lamella. Okay. Each little dot here, that's the top of a central canal or Haversian canal. Or instead of using the top of the dot, we can point to it, as it goes up and down. So on this, you can see the ones that are vertical here. If I point to any one of those red vertical lines, that's central canal or Haversian canal. And then any of them that are going horizontal, sideways, those are the Volkmanns or perforating. Yes?
Can you point out Sharpies again?
Say again?
Can you point out Sharpies?
Okay, I'm getting to that. Let me do. Periosteum is next, and then Sharpies. You see those little squiggly lines? That's those. That's Sharpies. So periosteum, and then Sharpies. So two of those will be on the test. And two of on each of these. That's the integumentary model, 2. The cell structure model, 2. This one, 2. We're doing the bones next, so you will see the skull. You might see it lying down like this. You might see it from the front. You might see it from the cranial floor. Not might, you will. You'll definitely see a cranial floor view. You definitely will see this thing from inferior like this. So what's your list for this? We've got a whole host of things on this. Wow, we could do a whole test just on the skull. So I'm going to simplify it for you a little bit. So this is really, you might want to be listening or recording this. For the actual bones, for the entire bones, the full bone, the frontal bone, parietal bone, occipital bone. Let's go to the facial set. Maxilla, palatine, zygomatic, mandible. Okay? Those are the bones. I pointed to every one of them at one time or another. Now, what about specific markings on these? That's what I'm going to do next. On the temporal bone, every one of these is fair game. That's why I didn't do temporal bone. So you're not going to get where I point to the temporal bone and say, what bone is this? So you have to read the question on all of these. Sometimes the question says, what bone is this? If I point to that mastoid process, and it says, what structure is this, or what bone marking is this? I don't want temporal bone. That is the temporal bone, but that's not the question. So make sure you read the question and answer the question. So make sure you can identify external auditory meatus, that's the ear hole. The mastoid process, that's that bump behind your ear. The styloid process, that's the pointy one that's sticking down there. Then you got zygomatic process, and then you got mandibular fossa. You remember where they were. The zygomatic process is that zygomatic arch thing here. It's the one that connects to the zygomatic bone. That just makes sense. Right? That was a quiz question. So the zygomatic process is actually on the temporal bone. You will see the bone where you'll see, I take my pen and draw it, I darken up the suture line to make sure you can see it. Because some of these, it's really hard to see. They're so worn. I take my pen, I darken that line. If I point posterior or behind that pen line, behind that suture line, which one is this? That's the zygomatic process. If I point in front of it, then what is it? That's the temporal process. It's the temporal process that's on the zygomatic bone. So I'm going to show you that once again over there. I'm going to show you and remind you of all of this. But for the temporal bone, every one of these is need to know. Every one of those need to know. On the occipital bone, both of those absolutely need to know. As a matter of fact, here's a hint. One of these is always on there. That's why they're underlined. I never do both. But I always do either the foramen magnum or the occipital condyles. So is that worth studying? Yeah, because you're guaranteed at least one of them is on there. I always do one or the other. What about on the ethmoid? Definitely, one of these. This is another one, they're underlined, because I always do either one or the other. I never do both, but you will see either I'm going to be pointing to Christogalli or I'm going to be pointing to the cribriform plate. So you absolutely need to know that. The sphenoid Soliturska has a high probability. Not always, but a high probability. What else do we got? That's pretty much it. Don't forget, this bone could be in any different position. How will I point to the zygomatic process? It could be like this, or it could be from the front like this, or it could be, you know, with it on the ventral inferior view. It could be from any position. What do we see from a frontal view here? We see frontal bone. I see zygomatic bone. I see maxilla. There is right and left to some of these too. I throw one or two of them in there, and that's kind of to keep you honest. I don't do right and left for every question. Even though there might be a right and left, I don't do it for every one. I just do it for one or two of them. So you got maxilla, right and left. You got zygomatic, right and left. You got frontal. There's no right and left to that. What was the other bone I did here? Mandible. Okay, it might be done like that. On this view, we can still see zygomatic. We can see mandible. We can see maxilla. We can see parietal now. A nice view of parietal. From this view, I can see frontal. We can do frontal. And now we got some good markings that we can see from this view. External auditory meatus, zygomatic process, temporal process. There's the suture line. Behind it is zygomatic process. In front of it, temporal process. What else we got? Styloid process, that's the pointy one that's sticking down. Mastoid, the smooth surface where the mandible fits in there, that's the mandibular fossa. I could do it from this view. Or we could do them from this view. You know what? On this two-dimensional picture, though, if I start pointing to these, you can't really see them. But on the actual bone, you can definitely see mastoid and styloid and mandibular fossa, external auditory meatus, and what's up here, the zygomatic process, the maxilla. Okay, so I have done that quite frequently. Up there, this view, the cranial floor, what do we got here that shows up very nicely? You got Christogalli on either side, cribriform plate, the big hole here, foramen magnum. So I can do foramen magnum from this view or from this view. If I want occipital condyles, has to be this view. They're on either side of foramen magnum. The next we did, that's the skull, the vertebrae. Atlas and axis, you just have to know them cold. They'll both be on there. Atlas, you'll probably get asked the name. What about the markings on these? All of these are fair game. Centrum, vertebral foramen, transverse process, spinous process, lamina, pedicle. Here's a gift. Forget that. I don't do this. I used to, but I don't do them anymore. Don't worry about the superior and inferior occipital sets. But every one of these, I've done every one of those. Which bone? Don't matter. If I do it on a lumbar or a thoracic or a cervical, doesn't matter. You should be able to answer all of them. Don't forget that transverse foramina. Obviously, if I want that, it has to be a cervical vertebrae. That's got about an 80% chance. I do that quite frequently. Not 100% of the time, but I got 2 AP1 classes. I might do it for one and not the other one. That hole there is what? Transverse foramina. That hole there is what? A vertebral foramen. So here's your clue. I always do one or the other. More frequently, I do transverse foramina, but I have done vertebral foramen. Centrum, that's the body. Lamina, that's between the spinous process and transverse process. Pedicle, that's between the transverse process. It's hard to see on the cervical one, so I never do that on the cervical. Pedicle, I'll do that on a lumbar or a thoracic vertebrae. Then there's some that I just asked, what's the name of this bone? Atlas, you should, as soon as you see that, you should know that's Atlas. Not enough. Also, it's which one? C1. So we get a little challenging here. Some of the choices will actually be wrong. It'll say Atlas C2 or Axis C1. So this is the test to see if you remember which one is the first one, which one's the second one. So we test you on that. All right? Atlas C1, Axis C2. Sometimes instead of asking the name for this, I'll ask you that bone mark. You need to know it both ways. Is it the dens or the odontoid? It's both. So sometimes we have odontoid on there, and sometimes I have dens on there. We got some cards that say odontoid, we got some cards that say dens. And we switch them out. All right? This is to keep students honest. Thoracic vertebrae can be used, lumbar vertebrae can be used. Don't worry about these articular facets for the ribs. You can't see them.
No, you're good.
Sacrum will be used on the articulated pelvis. That's on this. It doesn't get its own separate station. This is one of the stations. And if I want sacrum, oh, there it is, right there. I've done that probably about 70% of the time. Also on this articulated pelvis is that pubic symphysis. Also on this articulated pelvis is that joint between these two. So we'll do that. I'll show you those in a little bit. Now we can finish off the axial skeleton. This is the rib cage. 2 questions on this. There's 3 bones here and the costal cartilages. You don't have to give me the numbers here. If I point to this, all you have to be able to tell me is those are the costal cartilages. This whole thing is the sternum. I never asked you what's that whole thing. Either the top, the middle, or the bottom. You'll see lines drawn across there. Some of them have red lines, some of them have blue. That's supposed to be the different rooms, by the way. Manubrium, gladiolus, xiphoid. That's your, card. What are your choices? Manubrium, gladiolus, and xiphoid. And costal cartilage. Then you got the ribs. And you got a sternal extremity and a vertebral extremity. And what's on the vertebral extremity? The head and the tubercle. Here's the list. Costal cartilages, manubrium, gladiolus, xiphoid, and the ribs. Sternal extremity, vertebral extremity. Vertebral extremity also has more detail in the head and the tubercle. This is to remind you how the head and tubercle come together with the thoracic vertebrae. That just helps you with remembering. Manubrium, gladiolus, xiphoid, costal cartilages. The rib, a nice zoomed in picture of that, that's the sternal extremity. A zoomed in picture of this side, that is the vertebral extremity. So read the question. Do I ask for the structure, the name of this end of the bone? If I want the end of the bone, you're going to give me vertebral extremity. If I say the structure, that's the head, and that is the tubercle. Then we moved on to the appendicular bones. So we did pectoral girdle first. This is the shoulder. We had 2 bones for that, scapula and clavicle. What's your list for this? On the scapula, you got these markings: scapular spine, acromion, glenoid cavity, and coracoid. Begins with that girl's name, Cora, C-O-R-A, coid. On the clavicle, you got the 2 ends are the sternal extremity and the acromial extremity. So, first off, always be able to tell me what bone it is. What bone is this? Scapula. What's that? Scapular spine. Where's the acromion? Follow the spine to the end. Where's the coracoid? It's on the other side, anterior side. And where's the glenoid? That's the surface of the head of the humerus. So here's an angled shot so we can see it better. Scapula, scapular spine, acromion, coracoid, and there's the glenoid. For the clavicle, the end that's cut straight up and down vertical, that is the sternal extremity. For the end that looks flat like a paddle or an oar or a boat, flat like a pancake flat, that's the acromial region. So make sure you can label that. And don't forget, know the bone. Sometimes the question is as simple as, what bone is this? Next, we moved on to the humerus. This one will have 4 questions. This gets 2 separate stations. So what's your list for the humerus? We got the head of the humerus. No, I never do that. That's too simple. You got the 2 tubercles, and yes, they are tubercles. Be careful the choices. Some of the choices say greater trochanter, greater tubercle, greater tuberosity. Lesser trochanter, lesser tubercle, lesser tuberosity. Which one is it on the humerus? And I got nothing for you here except to say you just have to remember. I don't have a mnemonic or anything to remember that the humerus is the tubercle. And I don't even know why it's called the tubercle. It never made sense to me. And if somebody could tell me the sense to that, I'd be happy to hear it. It's the tubercle though, not the trochanter, not the tuberosity. Now, where are they? The greater is on the lateral side, and the lesser is on the anterior side. Halfway down the lateral side, you got this rough surface. It's hard to see, but if I put a sticker halfway down the lateral side of the humerus, you should know it's the deltoid tuberosity. It's for attachments of muscles. Then keep going. All the way at the distal end, you got that trochlea, the pulley-shaped joint surface, that's trochlea. And then the capitulum, that's the one that's shaped like a ball. And then you got lateral and medial epicondyle. The medial epicondyle sticks way out. To remind yourself of that, just touch the inside of your elbow. And then your brain, your neurons will start firing, and then it will say, yeah, that's inside, anatomical position, that's medial. So medial epicondyle. Epi means above, it's above the condyle. What's the condyle? It's the articular surfaces. Articular surfaces are condyles because they're smooth, and elevated, and they are make joint surfaces. So we are looking at the front, anterior surface of both of these. Why? Because we can see lesser tubercles sticking up right out you. All right. We also can see down here. We can see the medial epicondyle. It sticks way out, and right next to that is the trochlea, and all the way on the lateral side is where the capitulum is. Some AP1 students will confuse that the trochlea is this whole thing. It is the whole thing there on that medial side. All right? It's the whole pulley shape. The capitulum is only that ball right there. The rest of this is all trochlea. Everything's opposite here because you got a right and left humerus there. That's why it's right and left. You don't need to know that, but you need to be able to identify them by identifying where's medial and lateral, because right next to the medial is trochlea. Capitulum is all the way on the other side, lateral side. Why is that? The head of the radius articulates with the capitulum. Where is the radius? On the lateral side. It's the lateral bone. Remember, we went through all of that. Close-up view of this is the posterior side. Why? There's no lesser tubercle. And you look at the posterior side, you can't see capitulum. All you can see is that nice smooth surface of the trochlea. This is anterior side. Why? Because there's that bump sticking out there, that process sticking up, that's the lesser tubercle. And look, we can see all of this is trochlea and that is capitulum. Why is that one trochlea and this is capitulum? Well, look, there's the medial epicondyle. Remember that the medial epicondyle sweeps and goes way out. It sticks way out. The lateral one, it's just a nice, gentle, protrusion. It doesn't go out as far. And you can feel that on your own elbows. Then we got radius and ulna. This is not confusing at all. What letter of the alphabet is that? U. How do you spell ulna? U-L-N-A. There you go. It's only 4 letters. U-L-N-A. Well, there it is. So what's your list? For the ulna, you got the olecranon process, the coronoid, not coro, but coronoid, and then you got styloid process. To remind yourself, just touch the back here, that big bump on the back of your wrist. That is the styloid process of the ulna. That'll also help you remember that the ulna is the medial bump. Right? Boy, does that thing stick out. What's your list for the radius? You got the radial tuberosity, which is about 1 inch distal to the head of the radius. So the head's nice and round, and then about 1 inch away from that distally is the radial tuberosity muscle attachment. That big one that's in your arm. That's the biceps brachii attaches to the radial tuberosity. This also has the styloid process, but I'll let you know right now. I never went to that one. So, ulna, olecranon back here, the parrot bead shaped thing up here, that's coronoid, and the styloid process down there. Radius, the head of the radius is the round end, and then that's the radial tuberosity. The next bones we do is the wrist in the hand bones. Okay, so carpal, I shouldn't say wrist, that's carpal. By now you should have looked at this. What's the proximal row, what's the distal row? That was on your quiz also. The distal row is the row that's going right up against the metacarpals. Meta means in approximation to near or right after something. That's why these are metacarpals. They're right near the carpal bones. Okay, they're just after the carpal bones. That's why metacarpal. All right, first, second, third, fourth, fifth. You always start with the thumb side. The distal row, trapezium, trapezoid, capitate, hamate, trap, cap, ham. The proximal row, scaphoid, lunate, triquetrum, and pisiform you actually can't see from the dorsal side. It sticks up on the palm side, and that's so the ligament can go across the wrist and make the carpal tunnel. All right, which way will it be on your test? Will it be dorsal up or it doesn't matter. It shouldn't matter to you. All right. Don't forget, there'll be another one there. If you want, I want to see the other side. I studied it. Okay, pick up the other one. Turn it over. Find it on that one, and then turn it over and see how it all comes together. But one of the carpal bones will be on the test, and then the other question will be the metacarpal phalange. And metacarpal I've done like twice in 9 years, so probably one of the phalanges. So you need to know the row and the column. The column is first, second, third, fourth, and fifth. And the rows are distal, intermediate, and proximal. All right, so first one, no intermediate. Yes, you got a first distal phalange, first proximal phalange. The other ones, you got three. Fifth distal phalange, fifth intermediate phalange, fifth proximal phalange. So your list on your card for this is all the carpal bones, and then understand the phalanges and metacarpals and how they're labeled. There'll be one of the phalanges and one of the carpal bones. Then we do the lower extremity. You will have an articulated pelvis like this, and you will have an individual os coxa, which is the hip os bone, coxa hip. That's the hip bone. And three bones make that up. What's your list for these? Your list for these are the os coxa. I don't do that too frequently anymore. I used to point to that whole thing and said this structure is made up of a fusion of three bones. What is this called? It's the os coxa. And the sacroiliac joint. And we already did it on another slide. Let me remind you, what's that? The sacrum. I already did it on another slide. What's that? Pubic symphysis. So those three, pubic symphysis, sacrum, sacroiliac joint, those can only be done on this, on the articulated pelvis. What else could be on this? Well, the list for the os coxa. So what's the list for the os coxa? I never ask for ilium, ischium, or pubis. I'm going to ask for the markings on them. Iliac crest, one of the iliac spines, greater sciatic notch, ischial tuberosity, or ischial spine. I already did pubic symphysis. We talked about that. That's on the articulated pelvis. And I'm going to point to that piece of cartilage because that makes it so there's no controversy. That's only one thing that piece of cartilage can be, and that's the pubic symphysis. If I point to the end of the pubic bone, you'll be all like, I don't know if you want pubic bone or pubic, I can't tell what you want. Is the rami too? Could I put rami down? No confusion. I just don't even do it that way. But these are all possibilities here, and I'm going to show you where they are over there. These are also have the acetabulum and obturator foramen, and the little clue for you is one of these is always on the midterm. If I don't do acetabulum, then I will do obturator foramen, and vice versa. One of them will be on there. These can be done on the articulated pelvis, but they also can be done on the individual os coxa. Remember, what's the three faves on this one? Sacrum, pubic symphysis, sacroiliac joint. What else can I do on this? Oh, iliac crest. I've done iliac crest on this one. Acetabulum, sure. Obturator foramen, yeah. Piece of cake. What else? That's pretty much all I'll use this for. The other ones I'll use back. Usually you'll see it in this position because I could show you more from this position. Acetabulum, obturator foramen, ischial tuberosity, ischial spine, greater sciatic notch, iliac crest, then the spines. Where's anterior? The pubic bone points to anterior. Or you could do it the other way. The greater sciatic notch is the posterior side. So anterior superior iliac spine, anterior inferior iliac spine. Posterior superior iliac spine, posterior inferior iliac spine. Nurses will palpate across that iliac crest, define posterior. Why? Enter the femur. If you inject into that L, you're safe. But when you do that, what you're doing is you're going to cover up that greater sciatic notch. What's in there? This sciatic nerve. And anybody doing an injection into the gluteal muscle does not want to hit the sciatic nerve. That's how you avoid it. So that's I'm just reinforcing for you why you learn this. Really? Do I need to know this? Yeah, that's why. The next bone we do is the femur. Recognize it. Sometimes the question is as simple as, what bone is this? That's the femur. What's your list for the femur? You've got the greater or lesser trochanter, the lateral or medial condyle, you got the popliteal surface, and you got the patellar surface. You're pretty much guaranteed I'm not going to ask you for the name of the bone. Why? Because I always do either popliteal surface or patellar surface. So that already takes up one of my questions, which means the other question is going to be one of those. One of the trochanters or one of the condyles. The next bone we do is going to be the two lower leg bones, and that's tibia and fibula. They will not be together. They have their own station. They will not be together on the exam. There will be a station just for tibia and a separate station just for fibula. And you will not be able to put them together. So what's the list for the tibia? You got the tibial plateau, which is the top surface, tibial tuberosity, which is in the front, medial malleolus, which is at the distal end. What's the choices for fibula? What's the need to know here? The name of the bone, fibula, and the two ends. What are they called? One end's called the head. The other one's called the lateral malleolus. Be able to distinguish between those two ends. If you can't do that, don't leave today if you don't know how to do that yet. And I will show you again, right over there, before we leave. Then we move on to the foot. And what's your list for the foot? You got, I made, because the hand is, you got 8 of those, no, 3. I'm only talus, calcaneus, and cuboid. If you know those 3, you're going to get 2 questions right on your test. 2 of them you kind of already know, but not by these names. Talus is the ankle bone, so that's the top one. That's the one that articulates with tibia primarily, but also fibula. The lateral side of the ankle is your fibula, holding that talus into the ankle mortise. Talus. What does that sit on? Your heel bone, and that's calcaneus. Whereas cuboid is the cube-shaped bone right in front of the calcaneus. The reason why I picked on them in podiatry, those are extremely important bones in the foot. Extremely. The lateral column is what stabilizes the whole foot. Talus, calcaneus, cuboid. That should be a gift. Then we got these joints, the shoulder joint, and then the knee joint. What's your list for the shoulder? 3? Well, actually it is 4, because there's 2 of these. Acromioclavicular, corticoclavicular, and then corticoacromial. you break it down, you know where it is. Coracoacromial goes from the coracoid to the acromion. Coracoclavicular goes from the coracoid to the clavicle. Acromioclavicular goes from the acromion to the clavicle. So those things that you needed to know for the scapula and for the clavicle, if you don't know them for those, you're also going to get these wrong. But that's your list, that's it. I don't even do the other ones. Here's the clavicle. Here's the acromion. If I point to that, what is that? Going from acromion to clavicle, acromioclavicular. Here's the acromion. Here's the coracoid. And by the way, this is the old model. We got new models that they fixed this. That's not in the right position. It's supposed to be on the acromion over here. And you'll see on the new models, thank you very much, they did. They fixed that. It goes from the coracoid to the acromion. So if I point to that, that's coracoacromial. And the other two, there's one there and there's one on the other side that's hard to see because of the angle of this picture. But it goes from the coracoid, the base of the coracoid, to the clavicle, coracoclaviculus. There's your coracoclaviculus. Those are actually easier to see if you take this thing and look at it this way and lift that thing up and look underneath there. It won't be that way on the test though, will it? Well, you'll have one that's pinned and taped down and you can't touch, but there'll be one sitting on the table, and that one you can pick up. Here's your knee. What's your list for this? There's 3 things for this. Only 3 things. Actually 6, because there's 2 of each. There's 2 of each of these things. What are the 3 things? The 2 menisci, one medial and one lateral. The 2 cruciates, one anterior and one posterior. And the 2 collaterals, one medial and one lateral. MCL, medial collateral ligament. LCL, lateral collateral ligament. Right, we throw those around all the time in orthopedics. Because athletes are always injured. ACL, anterior cruciate. Yeah, those are getting injured every day by some athlete, somewhere. That's the importance of these. Here they are on this. Posterior view, I can show you every single one of these. I would urge you, when you come to the station, identify where lateral is. And that's easy to do if you remember the 2 lower leg bones. Tibia, fibula. Fibula is the lateral skinny bone. It's the big bump on the outside of your ankle. Lateral malleolus. Lateral. Lateral collateral ligament. Lateral meniscus. Medial collateral ligament. Medial meniscus. The upside down ligament that's shaped like a Y. The upside down Y there. Posterior cruciate. Anterior cruciate, that's that up in there. The anterior cruciate, when I do, I don't do this frequently, maybe 10% of the time. I will flip this thing around and show it to you from the front. But I don't tend to do that one. That is your review. That covers everything. They're all. And what's the first bone that we got here? Mandible. Okay, that's the mandible. What's the individual bones that's on the skull that you absolutely need to know? Frontal bone. Then on top, you got parietal bone. Right parietal, left parietal. All the way in the back, you got occipital bone. You know, you can pat that. What else do we got? The cheekbone. Zygomatic. Right zygomatic, left zygomatic. What else we got? Upper jaw, where the teeth go in. Maxilla. Right maxilla, left maxilla. What other individual bones do we have? Let's flip this sucker over like this because there's one more, really. You can see that dark line that I drew there. That's the palate. That's the roof of your mouth, your hard palate, right? Behind that, posterior to that, those are the palatine bones. Palatine bone. So that takes care of the individual bones. Now we got the bone markings. So what individual markings? Let's start with the temporal bone. I don't ask that as an individual bone because I got a whole host of markings I could use that for. Like the ear hole is external auditory meatus. Right behind the ear hole. Just like in your own body. Here's your ear hole, right behind it, that big bump that you feel. There it is. That's the mastoid. Okay? Right in front of it, but down inside and medial to it, that big pointy thing that sticks up, styloid process. So you got 3 already. And then you got that smooth surface right in front of the styloid, right in front of your ear hole, right in front of where your jaw opens and closes, which fits what? The condyle of the man, and you should play with this. You should look at this before you leave. Look where that fits. Look at that condyle of the mandible fits right in. Why? Because I use this one a lot. I would say at least 80% of the time, I'm going to point to that surface. And what is that? It's the mandibular fossa. Why? Because the condyle of the mandible articulates there. And you all know your jaw joint is right behind your ear. Well, that's where it is. There's the ear, and there it is, right there, right next to it. Okay? So that's the mandibular fossa. One more on this. And look, I drew I came on this book. This is me. I did it. Right behind that is what? Zygomatic process. That is the zygomatic process. What's right in front of it? The temporal process. The temporal process is on the zygomatic bone, and the zygomatic process is on the temporal bone. So you got your 5 markings of the temporal bone. Will it be, this ain't, no, maybe not. It might be, on the surface of the table like that, sitting down. Well, I can see them. You can see them. Styloid, mastoid, external auditory meatus. Sometimes I even take a stick and stick it in there and put the sticker on the stick. Yeah, it's obvious. Mandibular fossa. Actually, mandibular fossa is nice from this angle. All right. The same thing with the zygomatic process. I can do it from this angle too. And don't forget. Yeah, if I'm gonna use this station for palatine bone. Hey, I could do palatine bone and one of those temporal bone markings. See how that works? And then I don't have to move the skull around. Will you see it like this? Definitely. What do we see in here? What do we see in here? Up there you got, I told you one of these is absolutely definitely on there. Crista Galli. If I put a sticker on top of that big process sticking up there, that is Crista Galli. And if I put a sticker on the side of it where it's got all those tiny little holes in it, foramen, cribriform plate. One of them will be either Crista Galli or cribriform plate. And then you got back here in the styloid is the sella turcica. That's the home for the pituitary gland. And then we got the big hole there, and that is foramen magnum. So I could do foramen. Hey, I'm doing cribriform plate here. Let me do foramen magnum too on this particular station. I could do it like that, or I do it like this. Foramen magnum, and let's not forget those condyles, occipital condyles. So one of those will be on there. That's it. That's it on the skull. You can recognize your significant other, just like you know your brother, your sister, your mother. Hey, I know you. Yeah, I know him. Okay, Atlas, C1. This one, nothing particular on that. And this one, Axis, C2. But sometimes instead of doing Axis C2, what's that? Odontoid or dens. You need to know both ways because you don't know which to choice, what selection is on your card in your test. You don't know, so you have to know it both ways. When this was fill-in, by the way, I used to give bonus points for putting both, but we don't have that option. So then you got the other vertebrae. I'm going to just show you cervical ones for that. Remember, there's 2 foramen here that you absolutely have to know. Vertebral foramen, that's the thing that the spinal cord goes through, but this one also has transverse foramina, right? So I do that one quite a bit. I would say a good 70% of the time I'll do transverse foramina. If I don't do transverse foramina, then I do vertebral foramina. I do one or the other, and I tend to do transverse foramina more frequently. Because it's small, I'm going to show you everything on this one first. That's the centrum, vertebral foramen, the lateral process, transverse process, the one that goes straight posteriorly, spinous process. In between spinous process and lateral, and you can see I docking the stuff. I was at it again. I drew my lines on there. I point between those 2 lines. That is the lamina. And where the transverse process joins the centrum, that is the pedicle. And that's it. Now you got everything. I could use this one for that. Centrum. This is a lumbar vertebrae. You don't even have to be able to tell me that. Centrum, vertebral foramen, transverse process, spinous process, lamina, and pedicle. Okay, so four questions, but I use up 2 already on atlas and axis, so really on this too. Finishing off the axial, we do the rib cage. We got the sternum, manubrium, gladiolus, and the pointy thing at the tip, xiphoid. It's spelled with an X, but it's pronounced like Z. Also could do these costal cartilages. You don't need to know the numbers, just know those are the costal cartilages. That takes care of that. The rib will have a special station. What bone is this? The rib. What is this end called? That is the sternal extremity. It's the one that's nice and smooth, not a whole lot going on there, and then a nice, like somebody took a nice razor and make a nice clean cut. This sternal extremity. Well, why? Because it's got to go right and flush with the end of the costal cartilage, and that's how they attach. When they say you got a broken rib, more times than not, that's what's broken, and they call it a broken rib. This end is the vertebral extremity. We've got some things going on here now. This is not quite, not simple. What we have at the vertebral extremity, the head, and that bump right there, that process right there is the tubercle. So more commonly for that end, the vertebral extremity, we're going to do either head or tubercle. That finishes axial skeleton. We moved on to the shoulder next, and we got the 2 pectoral bones, and you got clavicle and scapula. Let's do the easy one first. First, what bone is this? Scapula. I've got clavicle. See why you check your work? Sometimes you just do something stupid like that. You get a brain freeze. Yeah, that's why you check your work. If you absolutely know you screwed up, like I knew I just screwed up, you change it. But if you're not sure, stick with your first answer always, because most of the time you'll be right. I could say I did that on purpose to make that point. That's not true. Clavicle, this end, sternal extremity. This end, acromial extremity. 3 things, and there's 2 questions on that. This bone, scapula. Now we got the scapula. This side, posterior side, scapular spine. Go all the way to the tip, acromion. On the other side of the joint, across the way from the acromion, coracoid. C-O-R-A-C-O-I-D, coracoid. In between it, the joint surface from the humerus, glenoid. Scapula. Scapular spine, acromion, coracoid, glenoid. And now you're all set for that. You're also all set up to answer the questions on that shoulder ligaments. But we're moving on to the humerus. 4 questions on this. Name the bone first. What bone is this? Is this a leg? Don't confuse it with the leg bone. Yeah, that fits here. That's an arm bone. This one doesn't fit on my leg. You're allowed to do that. You're not allowed to bring this to another station. But at that station, you hold it against your body and say, yeah, that's an arm bone. Okay. Humerus. There's the head. That points medial. What's on the lateral side? That whole big surface, greater tubercle. Okay? Then you got that little groove next to the groove, lesser tubercle. That points to the anterior side. Now you can orient yourself. This is the front. This is lateral. This is medial. Go down the lateral side, halfway down. If I point to the shaft of the bone, you know right away I'm pointing to deltoid tuberosity. And they call that one a tuberosity. It's the only thing you learn halfway down the shaft of the humerus. All the way at the distal end. This side, look at that, sweeps way out, like the inside of your elbow. That's medial epicondyle. Lateral epicondyle is the other side. Next to, on the anterior side, next to the medial epicondyle, that whole surface there, that my finger is in right now, that whole surface there is the trochlea. On the lateral side, the ball-like surface there, that is the capitulum. You flip this thing over, we can see medial epicondyle, I can see trochlea, but we can't see capitulum. You're pretty much guaranteed on your midterm exam, this will not be on the table like this, right? Because there's a lot more on this side. We can see everything on this side. You're probably gonna see it like this, not like this, all right? That's humerus. The 2 lower arm bones. Ulna, letter U, ulna. radius, round head, R, radius. Radius, about an inch distal to that big process sticking up, radial tuberosity. Radius, head of the radius, radial tuberosity. Ulna, your funny bone area there, olecranon, the parrot beak area here, coronoid, C-O-R-O-N-O-I-D, coronoid, and that tip, styloid process of the ulna, the styloid process. Then we move on to the hand, the bones of the hand. Where's number one? The shortest one, that's your thumb. Technically it's pollicis, but we didn't do that in detail. The thumb is called the pollicis, but that's the short one, that's the first. 1, 2, 3, 4, 5. Always start by that side. Always start by that side. So let's do the phalanges first. First distal phalange, first proximal phalange. Second distal, second intermediate, second proximal. So now we have to add intermediates for these. Third distal, third intermediate, third proximal phalange. Fourth distal phalange, fourth intermediate phalange, fourth proximal phalange. Fifth distal phalange, fifth intermediate phalange, fifth proximal phalange. Just take note that I started from distal. That will make sure I don't mess up and think that one of these metacarpals is one of the phalanges. That's happened on the test. Okay, I've seen AP1 students end up trying to call this a phalange, and then that messes up their intermediate and proximal thing. These are the metacarpals. First metacarpal, second metacarpal, third metacarpal, fourth metacarpal, and fifth metacarpal. Now, the rows of the carpal bones. If you start from the thumb side, that's what you want to do. The distal row, right against the metacarpals. Trapezium, trap, cap, hand. Trapezium, trapezoid, capitate, and hamate. Now the proximal row, next to the trapezium. Scaphoid, lunate, triquetrum, and to see the pisiform, you've got to flip it over. That's that little P-shaped bone. From the palmar side, again, you start by the thumb side. The distal row, again, trapezium, trap, cap, hand, trapezium, the trapezoid, capitate, and this is kind of cool, the hamate has a hook. So, you might want to look at that. And remind yourself that the hamate is the one with the hook, H and H, hook, hamate. And so even if this is down with the palm side down, with the dorsal side up, the other one, you can pick up and look at it. And then you can compare it to the one that stayed down. All right, so I did that to remind you of that. And then the proximal row from this side, scaphoid, lunate, triquetrum, and the pisiform sits on top of triquetrum. That's the upper extremity. Lower extremity starts with the articulated pelvis. The three biggies on this, the three I likes on this, are the sacrum, the pubic symphysis, and the sacroiliac joint. If I point to that space, I'm pointing to the joint, sacroiliac joint. Also fair game on this. Iliac crest, acetabulum, obturator foramen. Also, on this, iliac crest, acetabulum, obturator foramen. So those might be on this. What else do we have on this that this thing offers though? The iliac spines. Here's the pubic bone, that means this side's anterior, that means this side's posterior. You've got greater sciatic notch on the posterior side. So that's anterior, superior iliac spine, anterior, inferior iliac spine, posterior, superior iliac spine, posterior, inferior iliac spine, and just as a reminder, there's the greater sciatic notch. That sciatic nerve goes through there. On the ischium, that big rough surface on the back, that's the ischial tuberosity. And right above that is the ischial spine. That's everything on this. Now we move on to the femur. What's on here? You got the head of the femur, that points medial, which means on the lateral side, that big process on the lateral side, greater trochanter. This is the one that has the trochanter. lesser trochanter is on the posterior side. Down at the distal end, that's pointing medial. That means this side is medial condyle. That means this side is lateral condyle. Anteriorly, the two condyles, medial and lateral, come together. That is the patella surface. Flip it over on the posterior side, and now you got popliteal surface. And that's your femur. The two lower leg bones, tibia, fibula. Now let's do the easy one first. Fibula is the long, skinny one. You tell a little white lie, you just told a fib, so the little bone is the fibula. This end here, where the joint surface is at about a 45-degree angle, that's the doorknob looking one, that's the head. This one here, where it kind of comes to a very gentle point, but also the articular surface, almost straight up and down, almost vertical. That's the lateral malleolus. Fibula. This side's lateral malleolus, this side's the head. Make sure you can do that before you leave tonight. Then you got tibia, the flat surface on top, tibial plateau. The process sticking up in the front anteriorly, tibial tuberosity. And the pointy thing down here, that's that bump on the medial side of your ankle, medial malleolus. Then you got the foot. 3 bones I'm asking you to remember. Your heel bone is the calcaneus. The bone right on top of the calcaneus is your ankle bone, that's the talus. And the bone that articulates with the calcaneus just in front of it, anterior to it, cuboid. That's your foot. On the knee joint, from posterior, where's lateral? Look for the fibula. Now that you know that's lateral, lateral collateral ligament. The cartilage between the joint on that side, lateral meniscus. On the medial side, medial collateral ligament. The cartilage in between that joint on that side, medial meniscus. The ligament on the posterior side, that looks like it's the shape of that a letter of the alphabet, the Y, but it's upside down. Posterior cruciate. Up on the lateral side, above that, on the femur, that is anterior cruciate. For anterior cruciate though, this is how I do. And you can see it stays open for me. I can point to it there. That reinforces that the reason why that's called the anterior cruciate is because it goes to the anterior side of the tibia. So that's when I do anterior cruciate. And I don't do it a lot, 10% of the time I would say, but that's how I do it. Now we got the models. On the cell. Just to be complete, that is the nucleus, but that's too easy, I never do that. The pink thing there, this one, it looks like the Wi-Fi symbol, that's Golgi. Golgi apparatus or the Golgi complex. The blue stuff, the blue membranes that have ribosomes on it, rough endoplasmic reticulum. The blue that do not have ribosomes on it, smooth endoplasmic reticulum. The yellow vesicle down there, lysosome. We got a couple here cut open. That's also a lysosome. The orange ones, Dr. Sash used to call these the little cigars. Okay, the little cigars here. Some of them are cut, some of them are not. Mitochondria. Then this guy here, that he has those things that look like straws inside of it, centriole. Yeah, that's it. That's everything.
Question.
Then you got
Sorry.
bone model. Huh?
You said that nucleus. Is there going to be any question regarding the nucleus or no? Okay.
On the bone model, you can see, see the way this tape is? It's got the arrow to show you it's that whole thing. That's how we'll do osteon. Okay, if we do something like that and we want that whole circle, that's the osteon. What makes up the osteon? It starts with the central canal. I I tend not to, if I want central canal, I tend not to point to it this way. Why? Because it's much easier to point to it that way. It's any of the lines that go up and down, vertical. Vertical means goes up and down. Any of these red lines, those are arteries, by the way. It's not just arteries in there. They're neurovascular bundles. Artery, vein, and nerve is in there. But they like to just do as arteries. Okay, so that's Haversian canal or central canal. Those are the vertical ones. The ones that go horizontally, side to side, that's Volkmann's. Volkmann's easy even on top too, right? Because we got a whole bunch of them up here that go horizontally. So those would all be Volkmann's. Each layer here, that's why they do this, by the way. This is not what it does in the bone. They want you to see each lamella. So each layer is a lamella. So if I want lamella, I point to one of these little layers here. That's lamella. That's how I do lamella. This blue stuff on the outside, if I put a sticker right on top of that, that is periosteum. And those little blue squiggly lines, that's what anchors periosteum into the bone. That's the short release fibers. And that's your bone model measurements. Last is the skin model. Dermal papilla. Look all the way to the left. That's it out there. It's any of these undulations here, but you know, out here, if I point to that, you should know that's dermal papilla. That keeps it simple. Up in the dermal papilla, the yellow ones, one there and one there, those are the Meissner corpuscles. The ones all the way down below is 1, 2, 3, 4, 5 of them, Pacinian corpuscle. And then you got the glands, this one here, or this one here, or this one here that goes all the way to the surface of the skin. Those are eccrine or merocrine. Then over here, there's the hair shaft, the one that goes around the hair shaft. Here's another one going to the hair shaft. That's a sebaceous. S-E-B-A-C-E-O-U-S. That's a sebaceous. Here's another one going to the hair shaft, but that's not sebaceous, it's apocrine. Why? Look at the board on the bottom there. It says axillar region. We are in the axillar region for that one. So if you haven't taken note, look at this model and you'll see it's 3 different regions. The middle one is axilla. This one over here is scalp, but that really could have said anywhere else in the body. And this all the way over here, that's why it's so thin. That's the soles of the foot or palms of the hand. That's where the skin is really super thick. So that's why there's 3 different regions there. Why is that important to you? Because this gland is not a sebaceous gland, it's an apocrine gland. That is your midterm exam.